Access to health care should really be a basic right. It is a necessary thing. Clean water, education, food, right? These are basic things. I firmly believe that health care should be accessible to all, no matter what you can afford and what you can't afford. And for that reason, we have Medina Health Center.
So the genesis of Medina really goes back to 2004 when I was volunteering at the Trenton area soup kitchen. And what we saw from our patrons was, in addition to lack of food and education, there was an immense need to have access to healthcare. So then almost 10 years later, in 2014, we formed a new nonprofit entity called Medina Community Clinic, whose vision mission was to provide free specialty healthcare to the uninsured and the underinsured in the Trenton area. We asked our physician friends to volunteer, and we started off at 6 physicians in the Trenton area that eventually grew to 38 plus physicians who provide and volunteer their time to provide free access to healthcare. So over the last 10 years, we've provided free healthcare to thousands of patients in the Trenton area. But as healthcare has evolved, we found that a lot of our physician providers are now working for large health systems or large corporations that don't allow them to see patients in their own offices. So we quickly realized that we needed a new model, and that's the Medina 2.0 model, where we now actually have a brick and mortar facility where patients can come in, can walk in, and our providers have a place to serve these patients in Trenton, free access to primary care and specialty care.
Located in the center of Trenton, New Jersey, we are offering health care for anyone that needs it at no cost to the patients. If someone's feeling unwell and they're not sure the severity of the disease that they're dealing with or the severity of illness, seeing a primary care physician is often the best place to go.
For many years, for those that know Medina, they've been helping to provide free specialty care. Now, by having this clinic, they'll be able to have referrals from primary doctors, which is really key, because obviously before you get to that specialty, you need to see a primary care doctor.
Quality of care services, I think, are more important in areas like this, where healthcare is not accessible to everyone. There is a community of not only physicians, but philanthropists and other healthcare workers who are willing to donate their time and efforts to make this possible.
It's really heartwarming to see the number of physicians that want to just volunteer their time and donate their time to the community, to the people that otherwise would not be getting health care.
It's doctors doing what they have always wanted to do, which is care for people without having to worry about all the other strings that are attached to the healthcare system.
I chose to work with Medina Health Center because I really believe in the mission and the vision that Medina Health Center has. And that is to provide services to those that are often overlooked and underserved and generally without a voice. I believe that as a human being, we all have, or should have, inalienable rights to food and security and education and health care. And that isn't always the case in our communities.
Half of the treatment is compassion, care, right? And sometimes, and I see this team, build this clinic based on compassion and, and personalized care and this thirst to help the people.
So the city of Trenton has almost 100,000 people, of which maybe 10 to 15,000 are undocumented. There's only one large primary care center that serves around 16 to 20,000 patients. So that still leaves thousands of our residents in Trenton who don't have access to primary care. So what this does is it's created these healthcare deserts in inner city communities like Trenton, and because of the lack of primary care, patients then end up in the emergency room. This then creates a further burden on our hospital systems and somebody has to pay for this. So, Medina Health Center, being right in the city of Trenton, is a perfect solution to prevent patients from ending up in the emergency room.
The need for quality healthcare is big, it's massive, it's needed in the community. There's no providers, there's no specialist that will see a patient without insurance. Without Medina, that will not be possible.
This is an excellent missing link in healthcare. We believe what we're doing here at Medina not only is helping people themselves, but it's also helping the community.
It helps the entire community and raises up health outcomes. We've seen this time and time again in public health. So having them here is like an economic boost as well for the community.
Each one of us has that inner calling, working in collaboration to help out without being paid. It's just providing an avenue. That's a family, taking care of each other.
We hope to develop more relationships in the community and work with new partners and organizations that can help support our operations.
What we are creating here at Medina Health Center really is a blueprint for other communities across the United States to emulate and provide better health services for their own communities.
They can walk in, get dignified and honest health care at no cost.
There's really no catch.
It's free.
There is no catch. There really is no catch.
The uninsured finally have a place to go and receive not only care but dignity. It's a place where people find hope.